14-year-old girl's 10th surgery, thoracic deformity correction surgery after severe scoliosis surgery. A 14-year-old girl was diagnosed with congenital severe scoliosis after birth and underwent 9 spinal surgeries. She developed breathing difficulties a year ago and had to rely on oxygen to stay alive. Recently, we performed chest wall correction for the patient and achieved satisfactory results. On admission, physical examination revealed that her resting oxygen saturation was only 78%. She was tall and thin, her chest wall was asymmetrical, and her right side was completely collapsed. Surgical scar could be seen on the back. The physiological curvature of the spine had disappeared, and the deformity was obvious. Imaging examinations showed that there was a fixed steel plane shadow on the back, severe thoracic deformity, a significant shrinkage on the right chest, and severe compression of the right lung. The patient diagnosis was clear, and there were indications for surgery. After inadequate preoperative preparation, the operation was performed under general anesthesia. Lying on the left side, a longitudinal incision was made under the right armpit to expose ribs on the right side. After cross-cutting, matrix rib planes were used for plastic surgery and reconstruction to expand the right thorax and relieve the compression of the right lung. The surgery was successfully completed without complications. The postoperative oxygen saturation reached 92%. The thorax is the organic whole composed of spine, ribs, costal cartilage, and sternum. The shape of the spine affects the overall shape of the thorax. Scoliosis is a common spinal deformity. Because all ribs are directly connected to the spine, patients with scoliosis often have thoracic deformity. The more severe the scoliosis, the more severe the thoracic deformity will be. In clinic practice, many patients first undergo spinal surgery. Such surgery may have an impact on the shape of the chest. If the thoracic deformity occurs and affects respiratory and cardiac function, chest wall deformity correction must be performed. This child had severe scoliosis and the thoracic deformity. Although there were no dyspnea in the early stage of the shape of the spine was changed due to the surgery, the thoracic deformity significantly worsened, and the heart and the lung were significantly compressed, and the result symptoms appeared, and the thoracic correction surgery had to be performed. Thoracic deformities in the child include collapse of the right chest wall with the most severe lesion occurring in the ribs on the back near the spine. The ideal surgery is to completely change the shape of the ribs, but the project is huge and the risk of affecting the shape of the spine, so only relatively conservative measures can be used to correct it. We used matrix rib planes to extend the length of the main ribs to enlarge the right thorax, which not only improved the appearance of the thorax, but also relieved lung compression and ultimately achieved satisfactory results. I'm Dr. Wang from China.